Boston Brain Tumor Walk. I'm Deepak Berry, co-chair of today's event. After a great celebration of the 10th annual Boston Brain Tumor Walk, despite the weather last year, we are sad to not have gathered in person this morning, but we are very happy to have you here virtually for this robust program. Even with all the challenges this year has presented to us, our brain tumor community needs breakthroughs now. Brain tumor patients and loved ones are waiting for better treatments, a better quality of life, and cures. Patients, caregivers, researchers, and healthcare providers must work together to break the status quo and invest in promising treatments and technology to achieve these life-saving outcomes. Before we hear from some of the members of our New England brain tumor community, just a quick reminder that there's still time to share to Facebook Live. Post your in honor of BIP and let your networks know that you're with us this morning. 2020 participant and survivor shirts will still be sent out to all registered participants. So if you're joining us this morning and have not yet registered, you can do that now at Boston Brain Tumor Walk /Boston, and your shirt will be shipped to you in the coming weeks. You can also continue to connect with our community throughout the year by liking the New England Brain Tumor Community Facebook page. In New England, we are so lucky to be surrounded by amazing hospitals, innovative researchers, and dedicated doctors. As a researcher myself, I'm delighted to announce that I've been awarded the NIH Pathway to Independence Award by the National Cancer Institute to start my research on microRNA therapeutics for brain tumors. It is my honor at this point to introduce some of our local heroes who are joining us so we can defeat brain tumors once and for all.
Hello, my name is Timothy Smith. I'm a neurosurgeon at the Brigham and Women's Hospital in Boston. I'm honored and delighted to be participating in the 11th annual Boston Brain Tumor Walk on October 18th this year. Over the last 10 years, the Boston Brain Tumor Walk has raised more than $5 million towards brain tumor research. All the proceeds raised allow the National Brain Tumor Society to advance research and public policy, to improve the availability of new and better treatments, and to discover and fuel a cure for brain tumors. It is a privilege to be a part of the National Brain Tumor Society community, and together we can improve the lives of all those living with brain tumors.
Hi everyone, my name is Nida Fatima and I'm currently a postdoc fellow at Massachusetts General Hospital. The primary focus of my research involved both brain and spine tumor, and I'm really thankful to the National Brain Tumor Society for organizing this wonderful event. And I'm walking with all of you today so that the funding actually could be raised towards brain tumor research and we can actually advance the public health policy related to it. So with the aim to improve the availability of new and better treatment of patients suffering from brain tumor and discovery of new medical and surgical treatment, of course, this kind of walk is really very important. And I'm really thankful to all of you for taking time from your busy schedule and helping us in raising the funds, and most importantly, raising awareness among all patients suffering from tumors.
My name is Saksham Gupta. I'm a neurosurgery resident at the Brigham and Women's Hospital, and I was a medical student at Harvard Medical School, where I was fortunate to be involved in some breakthrough brain tumor research. Today, I'm walking in support of the entire brain tumor community of New England.
Hi, Mayor Marty Walsh here. Thank you all for joining the 2020 Boston Brain Tumor Walk. I know this walk looks a lot different this year, but I'm glad we can still come together to raise awareness about brain tumors, help support research and advocacy, and honor those we have lost to this terrible disease. As many of you know, I am a childhood cancer survivor, and I know what families go through when a child is diagnosed. Living with cancer is more than treatments. It's an emotional strain, financial pressures, the struggle of keeping a positive attitude. It's an experience that changes your life forever. But despite these challenges, I found strength through my community, my family, my friends and neighbors, and of course, a team of caring doctors and nurses. After 4 years of chemotherapy, I was cancer-free and able to have a normal childhood. Unfortunately, there are too many children who aren't able to have that same outcome. And that's why we're here today, to help give hope and support to the families going through this experience. Pediatric brain tumors are the leading cause of cancer-related deaths in children and the most commonly diagnosed cancer in children under the age of 14. The National Brain Tumor Society advocates for patients of all ages and their families by calling for more medical research funding and access to care. The more we learn about brain tumors, the closer we are to saving lives. We can all take action. Reach out to your elected official on this issue, share your experience, and help raise awareness. Let's continue to advocate for better treatment, healthier futures, and ultimately a cure for brain tumors.
Hi, I'm 15-year survivor and state lead advocate for the National Brain Tumor Society, Rich Paisner.
Hi, my name is Clay.
My name is Merritt.
And my name is Hadley.
We're Vermont state advocates for the National Brain Tumor Society.
My name is Kelly Taberge, and I'm the main state lead advocate with the National Brain Tumor Society.
I'm Dr. Nick Blondin, a neuro-oncologist at Smilow Cancer Hospital at Yale New Haven, and a Connecticut state advocate for the National Brain Tumor Society.
Together, we advocate for the federal government to make strategic investments in brain tumor research, improve healthcare delivery,
reduce health disparities, and raise the priority level for our community's urgent needs.
Join us as we advocate together from around New England so we can conquer and cure brain tumors once and for all.
Text brain tumor to 52886 to become an advocate today.
Thank you.
Good afternoon. My name is Erica Robinson, a National Brain Tumor Society advocate, captain of Team 3 Fine Lines, and I'm also a meningioma brain tumor survivor. Today is a day we've been looking forward to all year long. It's a chance for us to reconnect with friends, meet at the Balloon Arch or the Tree for Hope. Today, we find ourselves in uncharted territory, but I'm pretty sure that's what all got us here together to begin with, right? Brain tumor diagnosis is a life-changing event, not only for the patient, but also for their family and their friends. 2020 has been downright terrifying. So today, whether you are wearing this shirt, or this shirt, we are all together today to fight for the same cause. 700,000 people a year in the United States alone will be diagnosed with a brain tumor. Today, virtually, of course, we have brought together some of them to help spread awareness and their stories of hope. I'll let them introduce themselves.
Hi, I'm Brett Johnson. I live in North Reading, Massachusetts, about 20 miles north of Boston. In 2009, I was diagnosed with an oligodendroglioma, oligo for short. I had 2 different brain surgeries with chemotherapy and radiation in between. Now, 10, 11 years later, I am going to Dana-Farber every 4 months. I'll do that for the rest of my life to check to make sure that the tumor stays stable. I'm grateful for every single day. Back in 2009, there was very little research done on oligos. It is amazing how much has changed in a decade. And a lot of that is because of the National Brain Tumor Society and their effort, to fund oligo research. I am incredibly grateful to them. Thank you for being here today.
Hello, everyone. My name is Steve Adams, and I live in Hudson, New Hampshire. In August of 2017, I was diagnosed with stage 4 brain cancer called glioblastoma. Glioblastoma is an aggressive, fast-growing type of brain cancer that comes with terrifying prognosis. But at this current time, I am doing good. I always have a smile on my face, and that's all that matters.
Hi, my name is Lindsay Harder from Boston, Massachusetts. Last summer, at the age of 29, I was diagnosed with a grade 3 anaplastic astrocytoma brain tumor. Yeah, that's a cancerous one. Luckily, they were able to remove about 90% during my surgery. Some exciting details: I needed to be awake during the process, given the location of the tumor. I could have lost my ability to remember anything and speak properly, if at all. Unfortunately, the surgery did impact my vision. I'm unable to see out of the top right corner of both eyes, but any vision at all is something to be grateful for. Once the surgery was complete, I jumped into lots of chemo and radiation. This month, I will be finishing my 12th round of chemo, which will complete the process. Having lost my job due to the illness, my next steps will be to find my next journey in this life that I am so grateful to keep living.
Now let's check in with all of them and see what they're thinking and how they got involved with the Brain Tumor Walk and National Brain Tumor Society in general. I know for me, it was such a relief to find other people that could understand what I was thinking. When I met Steve and Mark, I was just so relieved that some other people understood what I was talking about. That's how we came together, and that's how we created our team. So I'm wondering, what drove you?
I became involved with the National Brain Tumor Society and their annual Boston Brain Tumor Walk is because I had a family member looking up information about GBM. She came across the Boston Walk that National Brain Tumor Society has set up. We got a team together with family and friends and made a team called Sexy Steve Strong. We have been doing this for 4 years now, and we love everything about it and everything the National Brain Tumor Society represents.
Being diagnosed with brain cancer drove me to find out more about this illness and to do everything and anything possible to help find a cure. This isn't just about me. It's also about the many children, adults, mothers, fathers, brothers and sisters, anyone and everyone who have been impacted by this, and those who will be impacted in the future.
The most important thing to know is that in 2013, the National Brain Tumor Society put Tanya Seidel and me together. We didn't know each other at all, but we had the same tumor. And they suggested that we create a team to support each other and to support all of those who have oligodendrogliomas. So we created Team Oligo, and with 2 other team captains, we are now a team of about 90 people supporting us. The National Brain Tumor Society has lots of other teams with people who have oligos. We're just one. We do it because of community, for support. It's not just about the money for research. It's about we're really a family. And so when Tanya died 3 years ago, a part of our family died. We keep walking, and we walk for her, and we walk for all of us that have this tumor.
What message would you like others to know about what it's like to be a brain tumor survivor?
To find out that you have brain cancer, one of the worst types of illnesses that exist, you are drawn to find support and the best possible way to continue your life. That varies based on who you are and what you need. But to remember that each day is a gift seems to be a very natural life change that we all experience and pass along to those that are willing to hear us.
So listen, we all have a choice how we face our mortality, how we face really hard illness. For me, it pushed me toward being grateful for every single day, every single moment. That's a choice for me. I get to make every single day. It's changed who I am. It's changed my view of the world. It's changed my perspective of what's important, my most important relationships. And yeah, it's not easy.
I want others to know that fighters like me, we have our good days and we have our bad days, but we always stay positive and we always stay strong, because I feel with all the research being done, they will find a cure for this terrible disease soon.
Could you please share your thoughts and experiences about having a brain tumor in the time of COVID-19? We always say it's a crisis within a crisis, but if you could share with us, we'd appreciate it.
COVID-19 has been really hard and very isolating for a lot of people, especially people like me who have a very weakened immune system. My wife recently stayed at a hotel due to the fact she works with COVID-19 positive individuals and was scared to bring it home to me. I have learned to adjust and live life as best as I could due to all that's going on.
So the COVID virus, that's a tough one. It's a tough one for everyone on this planet. For those of us with brain cancer or a brain tumor in general, anybody that's on chemo, for example, or sick, they are a bit more at risk than others. Not that it should be comparable or anything, but there are some that don't consider this virus a threat. Meanwhile, there are people dying from this, people getting sick, and it's frustrating. It's frustrating to have to explain to others why you need to be safe, why you can't go out to dinner, why you can't hang out with a group of people. In the end, being safe and protected as much as possible, that's been my goal. It doesn't mean I don't get nervous. It doesn't mean that I don't let people down. But staying safe and not ending up in the hospital. I already have risks of ending up in the hospital. So something like this is easy for me.
We wear masks to protect ourselves and to protect other people. As brain tumor survivors, we are immunocompromised. And at the same time, we want to make sure that all those that we love are safe too. So I always wear a mask. What it also does, I will tell you, what it also does for me is make me realize that I have something, that hope, that I can offer other people who are terrified during this pandemic.
Finally, what are you most grateful for as a brain tumor survivor?
You know, when you start looking at life through a different lens, you see gratitude everywhere, things that you're grateful for everywhere. So maybe that's what I'm most grateful for, is that my perspective is more clear, more honed. It may sound hokey to sound like, oh, I'm the grateful one, but it is the truth of my life. Every single day, I get to look at my family, my friends, what I get to do, how I get to live, how I choose to live. That's all part of my brain tumor. And so for that, I'm grateful.
Hello, everyone. So I am going through a lot with this terrible disease, but I always stay positive and I always stay strong. And the reasons being is I have the most amazing friends and family a fighter like myself could have. They always push me in the right direction and always tell me things are going to be okay. And that's what I love about my family. Again, I love you all so much, and thank you always for being there and telling me everything's going to be okay.
As a brain tumor survivor, I'm grateful for all the small things and, of course, the big ones. But yeah, I'm so grateful for waking up each morning, seeing the beautiful sky, smelling the natural scents of this earth, hearing the birds chirping, telling my husband how much I love him. I get excited about breakfast and a walk outside. Saying that having a family, having loved ones, surrounding yourself with the things that you love, it's just that. That's all it takes to keep me going, hoping, praying, believing, fighting. I won't give up.
Alexa, play Don't Stop Believing by Journey.
Don't Stop Believing by Journey on Amazon Music.
We would just like to take this time to say thank you to Brett, Lindsay, and Steven for sharing their stories with us today. It means a lot for you to share your stories with people. You have no idea how many people that you have touched. We are honored to have you be part of our community. I'm excited to send it over to Tom Roloff, who is the chair of our board of directors at National Brain Tumor Society. I miss you, Boston. I love you. I can't wait to see you again in person. But be safe, and we will meet again. Thank you.
Thank you, Erica. Hi, I'm Tom Roloff, Chairman of the Board of Directors of the National Brain Tumor Society, Captain of Team Del Difference, and the Brain Tumor Survivor. It's such an honor to join you today. Over the last decade, our understanding of brain tumors advanced in ways we never thought possible. Now, we're poised to leverage these insights into new treatments and cures. Join us in the decade ahead, and together, we can defeat brain tumors once and for all.
Hi, everyone. My name is Tori Best, and I facilitate Meditation Mondays with National Brain Tumor Society and my dear friend, Rachel Kittleson. I've lived in Southeastern Massachusetts my entire life, but I'm here today because the person I call home isn't, not in the physical sense, anyway. My mom, Peggy Basic, was will always be the most compassionate human I will ever know. With her, there was no stranger, just friends she hadn't met yet. Sunlight radiated from her face and her heart. There was a fierce generosity in her spirit, and maybe her spirit just grew too big for her body. My mom passed away with glioblastoma in 2014, but before that, we threw a dance marathon in her honor to raise money for National Brain Tumor Society, and she passed just a few months after. Now everything I do is in her memory instead. In honor or in memory, I'm here today to say, take the thing you love and make gold of it for the person who brought you here. Maybe we can't have big in-person community events right now, but maybe you create a virtual class where every ticket for admission is a donation straight to National Brain Tumor Society. Maybe you put together a virtual yoga practice and meditation like I did on Glioblastoma Awareness Day. The community events team at National Brain Tumor Society can help you create a fundraising page and make your vision come to life. Maybe you create a virtual poetry slam or a concert, and right from the heart, let it spill out of you and share it with your friends and family. Maybe you write to Congress. Maybe you give funds, give time. It's invaluable. Use your imagination. Let your creativity be a spark, and be afraid of the dark, but do it anyway. And then keep going, keep moving forward, keep dancing, keep loving, keep breathing until you can't anymore. I am forever grateful for every opportunity to make good out of grief, in honor or in memory. Thank you for being here.
Hi everyone, my name is Katie and I was one of the athletes for the Gray Endurance Challenge this year. My dad was recently diagnosed with a glioblastoma in June of 2020. Prior to my dad's diagnosis, I really didn't have much knowledge of glioblastomas, nor did I have much knowledge of brain tumors in general. So I was looking for a way to educate myself and to become a more active participant within the community. Upon doing some research, I came across the National Brain Tumor Society's page. Upon entering the page, I saw something called the Gray Endurance Challenge, and that immediately caught my eye. I'm a very active person. I've played sports all my life, and within minutes, I found myself creating my own page. I wrote up my story. I talked about my dad, talked about myself. I set my challenge and I set my goal. My challenge was to run 26.2 miles each week as my dad was completing his 6-week radiation plan. That's running a marathon each week for 6 weeks. And that's something that I'm pretty sure I can never do. I've never run a full marathon before. So running one every week for 6 weeks was going to be a challenge. And that was the point. My dad is going through something that's completely new to him, going to be a challenge for him, going to be a struggle for him. So I wanted to go through that struggle with him. With life, being a student, working, I did struggle a lot more than I thought I would to complete the 26.2 miles, but I tried my best. And that's all I can say is that I really did try my best. My dad is a lot stronger of a person than I am, and that's something I'll admit right then and there. As for my fundraiser goal, I set it at $2,000. I figured that I would just share the page with my friends, my family, my coworkers, my neighbors, anybody that I knew. I figured I would just share the page and everyone would just give $1. By the end of the 6-week period, we had raised $5,500. And I really can't say thank you enough to all of my donators, to my friends, to my families, to my coworkers. Thank you from the bottom of my heart. It really did mean a lot to me and my family, and I know that it helped motivate me. Anytime that I would be on that treadmill running or I'd be out for a run, I would refresh my email literally, and I would just see donation just pouring in, and that really did motivate me to keep going. To National Brain Tumor Society, I wanted to say thank you to you guys. You really did make a challenge like this and the circumstances like this a lot more enjoyable to participate in. So thank you for that. And lastly, I just wanted to say to my dad, Dad, I am so proud of you. to see how you are handling this situation. Our lives have definitely changed a lot within the past few months and drastically, but you are handling this with such grace, motivation, determination, and it truly is inspiring to watch. I'm so thankful for you. I'm so proud of you. I love you. And I really can't wait to see where this journey takes us, because I know that this is far from the end. I love you, Dad. Thank you.
Is Jessica Junta, co-chair of the Boston Brain Tumor Walk. We are so grateful for our community and the amazing corporate sponsors that support our mission. We are especially thankful this year to have so many new sponsors join us. Thank you to the 11th annual Boston Brain Tumor Walk sponsors: Agios Pharmaceuticals, Black Diamond Therapeutics, Karyopharm Therapeutics, SBLI, AAF CPA, Century Bank, the Mosley Group, Alban Pond, Papagenos, Garrett Family Market, and D'Angelo. Our national sponsors, Genentech and Novocure, and our Beantown sponsors sponsored both the Boston Brain Tumor Ride and the Boston Brain Tumor Walk. Alex Brown, a division of Raymond James, American Surgical Company, Brigham and Women's Department of Neurosurgery, and Massachusetts General Hospital. Thank you. We are also grateful for all of you, our amazing teams and participants. In a year that would have been easy to skip, you showed up. You continue to raise vital funds for brain tumor research and advocacy, and you show what a true community is. A big shout out to all the new teams joining us this year. Welcome. I look forward to meeting you in person someday. Also like to give a big shout out to teams who have been participating for 5 or more years. Thank you for your continued support and commitment to NBTS.
Thank you, Jessica. Typically at this time, we would hand out some awards, but just like everything else, we are doing this differently this year. We are not announcing the top fundraising teams or individual fundraisers today, but we are challenging you over the next 2 months to raise a little more. Ask one more person to support you. On December 18th, we will share who the top team and the top fundraising individuals are. It is now my honor to introduce the CEO of the National Brain Tumor Society, David Ahrens.
Hi, I'm David Ahrens, CEO of National Brain Tumor Society, and I'm so happy to join you today at the Greater Boston Brain Tumor Walk. I love this event because of the amazing Greater Boston, Greater New England brain tumor community comes together each year to support each other and to help us advance our cause. I also get to participate today with Team All In. Go team! Really happy to be with you today, and thanks for all you've been doing to raise dollars and support for this cause in honor of our friend Jamie. A sincere thank you to all who have been raising money, fundraising during this unprecedented time in our country. We know how hard hit the Greater Boston and Greater New England communities have been and continue to be by the coronavirus and the economic fallout. We truly appreciate that you've continued to provide NBTS with your critical support. Now, please know that the dollars raised through NBTS events like this will be put towards advancing our critical mission through these challenging circumstances. In addition to research and advocacy, this includes providing support and navigation to the community, and we have resources available to specifically address treatment or other health-related concerns brought on by COVID-19. Just as you are here for us, we are here for you, and we're in this together. Again, now is such a critical time to keep the pedal down to reach our mission. A brain tumor diagnosis is also a crisis, and patients live from MRI to MRI. We can't let anything hinder our mission during this time, not now and not ever. Now, in the last 10 years, thanks to research and advocacy supported by you and through the National Brain Tumor Society, we've made significant progress. I wanted to share some of that with you. There are new, clear, rational treatment strategies that have emerged for researchers and biopharmaceutical companies to follow based on an increased understanding of how tumors grow, function, and evade current treatments. We've learned how to increase the likelihood of success in killing brain tumors using treatments that harness the body's own immune system called immunotherapy. We've also developed a clear research plan to exploit across many tumor types, from meningiomas, other non-malignant types, to malignant gliomas, including ependymoma, oligodendroglioma, astrocytoma, and glioblastoma. And the same for the pediatric space, including those with some of the greatest need, the urgent need, such as DIPG, ATRT, ependymoma, and medulloblastoma. Now, thanks to your support, one of the most innovative clinical trials in brain tumor history was launched and is expanded this year, and that's GBM Agile, with sites all over the country. And thanks to your advocacy, federal funding for brain tumor research has increased by approximately $100 million in the last 5 years. That's huge. And thanks to you, NBTS is poised to help launch new clinical trials this year and even more next year if we can raise enough support. We can do it together. There have never been more promising scientific opportunities to beat brain tumors than right now. And right here in the Boston area, with all of the great hospitals, labs, and biopharmas. Some of our partners are among them, including leading innovators such as Brigham and Women's Department of Neurosurgery, Novacure, Black Diamond Therapeutics, American Surgical Company, Agios, Genentech, Mass General Hospital. Just as NBTS advances research through its Defeat Brain Tumors program, we are also helping patients and families through the NBTS Patient Support and Navigation Service. We continue to offer resources for patients, caregivers during this time, as I mentioned before. Come check out our clinical trials finder, and you can print out a list of the trials that may be right for you and take that to your care team. Our new Meditation Mondays program, you heard from Tori Best, amazing facilitator who leads that program, offering the ability to meditate. You can find out more about these programs through our website. Join the Brain Tumor Support Conversations virtual support group once a month. It's welcome and wide open for you to join. Now, we have to keep going together. And before I go, I'd like to do a huge shout out and thank you to Mayor Marty Walsh, our Senators Markey and Warren, the Massachusetts delegation, including Representatives Joe Kennedy and Karen Clark, and our dauntless New England advocates, led by the fearless Rich Paisner. Thank you to local doctors, researchers, brain tumor survivors, corporate sponsors, our wonderful Boston Walk Committee, and our staff like Rachel, most importantly, all of the amazing teams, participants who are so committed to help us conquer and cure brain tumors once and for all. Please stay tuned for our Remembrance ceremony featuring Christine Suau from Team Why Not Devon. Thanks again. Be well, be safe, and know that NBTS is here for you. See you soon.
Hi, I'm Christine Suter-Swow, captain of Team Why Not Devon. I am lucky enough to be joined by 3 of my sons today, and we are excited to participate in the Boston Walk this year in honor and in memory of my son and their youngest brother, Devon. I know that usually today, for some of you, is a time of community, of coming together, celebrating life, advocating, and finding a way to fund research. For some of us, it is a time of deep sorrow, profound loss, a very big misunderstanding, and lives gone way too soon. But there is room for these emotions and obviously so much more. This year has been unlike any other. We are doing our first virtual walk. But for me, and I think for these guys, I can tell you that so much of what we're going through right now reminds us of our fight for Devon's life. 3 years ago, my youngest son was diagnosed with diffuse intrinsic pontine glioma and given just 8 months to 2 years to live. Life as we knew it stopped. These guys were out of school, we were out of work, and we traveled the world trying to find a cure. There was so much uncertainties, unknowns, and it was such an unprecedented time. And with all of that comes fear. But in the depths of fear, you need to find hope. Hope is the only thing that got us through Devon's 8-month and 3-week battle. Hope is what will get us through this time now. Hope for a cure, hope for funding for research, and hope for a better tomorrow. We are so thankful for this community and the ability to gather in some capacity to raise research for vital funds for brain tumor research. Thank you so much for joining us today for the 11th annual Boston Brain Tumor Walk. Please remember to share how you and your team walked today on social media using the hashtags
BBTW2020
and hashtag Why We Walk.
Thank you so much. Have a really fun time today.